Welcome to AI DocuFeed, where we break down complex documents into easy-to-understand podcasts. Today, we're tackling the official Medicare and You 2025 Handbook. Be sure to check the show notes for links to frequently asked questions and worksheets you can use to follow along or fill out after the show.
Today we're tackling something that can feel like a real puzzle, especially as you approach 65. We're talking about Medicare, but no worries, we're going to break it down and help you make those smart choices for your healthcare.
Absolutely. Medicare can seem like a maze, but once you understand the basics, it all starts to click into place. And that's what we're here for, to help you navigate this journey confidently.
So let's start with the fundamentals. What exactly is Medicare?
Medicare is a federal health insurance program. It's mainly for people who are 65 or older, but it also covers some folks under 65 with certain disabilities or folks with end-stage renal disease. Think of it as a safety net for those healthcare expenses.
A safety net. Yeah, I like that. But Medicare isn't just one big thing, right? It has all these different parts. Can you break down what those are all about?
Yeah, you got it. There are four main parts: A, B, C, and D. Each one covers a different aspect of your healthcare.
Let's start with Part A then. What does that cover?
Part A is your hospital insurance. It covers inpatient hospital stays, care in a skilled nursing facility, some home health care, and hospice care.
For those, more serious situations, Part A is there. What about just regular checkups and visits to the doctor? Is that where Part B comes in?
Exactly. Part B, that's your medical insurance. So that covers a whole range of services: doctor visits, outpatient care, home health services, and durable medical equipment. Things like wheelchairs or walkers. And importantly, it also covers preventive services like screenings and those yearly wellness visits so you can stay healthy.
Staying on top of your health, that's so key. But medications, those costs can add up too, especially as we get older. Does Medicare help with that?
It does. Part D is all about prescription drug coverage. It helps cover the cost of those medications, and it also includes many recommended vaccines.
So we've got Part A for hospitals, Part B for doctors and outpatient services, Part D for prescriptions. Now what about Part C? What's that one all about?
Part C, that's Medicare Advantage. It's offered by private insurance companies, but they work with Medicare. These plans kind of bundle Part A, Part B, and often Part D, all into one package.
So it's like a one-stop shop for Medicare coverage. It sounds pretty convenient.
It can be. And on top of that, these Medicare Advantage plans might offer some extra benefits, that you wouldn't get with original Medicare, like dental, vision, or hearing coverage. Sometimes they even include things like gym memberships or meal delivery.
Those extra perks are definitely a plus. But I'm guessing there are some pretty key differences between original Medicare and these Medicare Advantage plans. What should folks really be thinking about when they're trying to decide which way to go?
You're right, there are some differences. With original Medicare, you have the flexibility to see any doctor or hospital across the country as long as they accept Medicare. So that's a big plus for a lot of people.
That flexibility does sound great, but I imagine original Medicare doesn't necessarily cover 100% of all your expenses. So are there out-of-pocket costs? And is that where Medigap comes in?
Right.
What exactly is that?
So original Medicare does cover a big chunk of your healthcare expenses, but you might still have some out-of-pocket costs like deductibles, co-payments, or co-insurance. And that's where Medigap steps in. It's also called Medicare Supplement Insurance, and it's designed to help with those out-of-pocket costs that original Medicare doesn't pick up.
Okay, so it's like a safety net for your safety net.
Got it.
Got it. So Medigap helps reduce those out-of-pocket costs with original Medicare. How do things work cost-wise with those Medicare Advantage plans?
Well, usually Medicare Advantage plans have set co-payments, and they might have lower monthly premiums compared to original Medicare. Plus, like we talked about, you might get those extra benefits, but there is a little bit of a trade-off.
What do you mean?
Well, with Medicare Advantage plans, you're typically limited to seeing doctors and hospitals that are in the plan's network.
More flexibility with original Medicare, potentially lower costs with Medicare Advantage, but with a limited network. That sounds like a pretty big decision to make.
And that's why it's so important to really think about your own needs and preferences. There's no single right answer for everybody. Do you want the freedom to choose any doctor you want? Or are those cost savings and extra benefits more important to you, even if it means you might have fewer choices when it comes to providers?
It sounds like something you really need to research and think about carefully. But before we jump into choosing a plan, let's talk about who's even eligible for Medicare and when they can sign up.
So you become eligible for Medicare when you turn 65. But you can also qualify if you have certain disabilities or have end-stage renal disease. And it's important to pay attention to something called your initial enrollment period. It's a 7-month window that surrounds your 65th birthday. So it starts 3 months before the month you turn 65, includes your birthday month, and then goes for another 3 months after. This is really the best time to enroll in Medicare because you can avoid late enrollment penalties.
Penalties?
Yeah.
Uh-oh. Why is timing so crucial when it comes to signing up for Medicare?
Well, if you delay enrollment past that initial enrollment period, you could end up paying more for your Part B and Part D coverage. Those are those late enrollment penalties we were talking about.
So waiting too long to sign up could actually end up costing you more down the line. I get it. Deadlines are important. But what if someone, misses that initial window? Are they just stuck with those penalties forever?
Not always. There are a few situations that allow you to enroll outside of those standard periods, like, for instance, if you lose your employer-sponsored health coverage or if you move out of your plan's service area. But really, it's always the best to try to enroll during that initial enrollment period to just avoid any potential problems.
Sounds like good advice. Are there any key dates for 2025 that our listeners should mark on their calendars?
Absolutely. October 1st, 2024. That's when you can start comparing your current coverage to the options that will be available in 2025.
So kind of like open enrollment for Medicare.
That's a good way to think about it. And then between October 15th and December 7th, 2024, that's open enrollment, when you can make changes to your coverage for the following year.
What exactly can people do during open enrollment?
It's your chance to join, switch, or even drop a Medicare Advantage plan or Part D drug plan. You can also switch from Medicare Advantage back to original Medicare if you want.
So basically make sure you're all set for the coming year. Then what happens on January 1st, 2025?
That's when any changes you made during open enrollment take effect. And if you stick with your existing plan, any changes to the costs or benefits also start then.
So it's like the new year for your Medicare coverage. What if someone realizes they need to make a change after January 1st? Do they have to wait a whole year?
For folks in a Medicare Advantage plan, there's one more window of opportunity. From January 1st to March 31st, 2025, you can switch to a different Medicare Advantage plan or even go back to original Medicare and choose a Part D drug plan.
So there's a little bit of flexibility to adjust your coverage if you need to. That's good. But I imagine this whole process, with all these choices and deadlines, can feel pretty overwhelming. Are there resources available to help people navigate all this?
You bet. Medicare.gov is a great online resource. It has all sorts of information about the different parts of Medicare, enrollment details, and even tools to compare plans in your area.
So one-stop shopping for Medicare info. But what if you're the kind of person who prefers a bit more personal guidance?
Well, there are also these free counseling services called SHIPs. That stands for State Health Insurance Assistance Programs. They can answer your questions, explain the enrollment process, and even help you find programs to assist with those healthcare costs.
Having someone walk you through it all, that's a huge help. You don't have to go alone. Now, I know there are some pretty big changes coming to Medicare in 2025, right?
Yeah, there are some updates. One big one is the $2,000 cap on out-of-pocket drug costs for people with Part D plans.
That sounds like it'll make a big difference, especially for people who rely on expensive medications.
Definitely offers a lot more financial protection. Another big change is the expanded coverage for mental health.
That's so important these days. What exactly will be different about the mental health coverage?
Well, you have more access to mental health services, including more telehealth options, and there'll be coverage for a wider range of providers.
What's next?
Well, in Part 2, we're going to dive into how to choose the right plan for your individual needs. We'll get into more detail about the differences between original Medicare and Medicare Advantage, talk about some cost-saving strategies, and share some tips on how to navigate that whole enrollment process.
Let's face it, Medicare can be overwhelming. From figuring out parts A, B, C, and D to understanding enrollment periods, it's a lot to take in. But don't worry, we've got you covered. Check out the show summary for a downloadable FAQ sheet and a worksheet designed to help you navigate Medicare step by step. These resources are perfect for following along with today's episode or diving deeper into the details later.
In Part 1, we got to cover those Medicare basics, the different parts, who's eligible, all those enrollment periods. Now it's time to tackle a big question, choosing the right coverage for you.
It's decision time, right? Original Medicare or Medicare Advantage. What are the big things folks should be thinking about when they're making this decision?
Well, I think the best way to approach this is to really weigh what's most important to you, what your healthcare needs are. Think about your health, your budget, and how much flexibility you want in terms of choosing your doctors and hospitals.
Let's start with Original Medicare. I remember you mentioned earlier that it offers a lot of flexibility. Can you expand on that a little?
Yeah, with Original Medicare, you have the freedom to go to any doctor or hospital in the country that accepts Medicare. So that's a really big plus for some people, like if you travel a lot or you really want the option of seeing specialists without having to get referrals.
Having those choices is a big deal. But we know Original Medicare doesn't cover every single healthcare cost. So how does Medigap fit into the picture?
Medigap or Medicare Supplement Insurance, it's there to help with those out-of-pocket costs that Original Medicare doesn't cover. Things like your co-payments, co-insurance, deductibles, Medigap can help with those.
Okay, so it fills those gaps. Give me an example just to make it a little more real, how that might actually work.
Oh, sure. Imagine you need a surgery. Let's say it costs $5,000. Original Medicare might cover, say, 80% of that. That leaves you with $1,000 to pay out of pocket. Now, if you have a Medigap plan, it could help cover that $1,000.
Wow, that's a significant difference. Now let's switch gears and talk about Medicare Advantage. Why do some people choose those plans?
Well, the big thing with Medicare Advantage is that it packages things together. Part A, Part B, and often Part D, all in one plan. So it can simplify things. They often have lower monthly premiums, some extra benefits, and they might have a limit on how much you spend out of pocket each year.
Sounds pretty appealing.
Usually with Medicare Advantage, you're limited to seeing doctors and hospitals that are in the plan's network.
So it's about finding that balance between cost and flexibility. Like if you don't see specialists often and you're more concerned about keeping costs down, maybe that network isn't a big deal. But if you really value that freedom to see any doctor you want, then maybe Original Medicare is a better fit.
That's it. Think about your own needs. There's no right answer for everybody.
There are resources out there to help people sort through all this. We mentioned Medicare.gov. What kind of info can people find on that website?
Medicare.gov is a great place to start. You can learn about the different parts of Medicare, enrollment details, and you can even use their tools to compare different plans in your area.
It's like a Medicare encyclopedia online. But some people prefer more of a personalized touch. Are there options for folks who want that kind of one-on-one help?
Definitely. There are these state health insurance assistance programs, and they offer free counseling, totally unbiased. They can answer your questions, walk you through the enrollment process, and even help you find programs to help with costs.
That personal touch can make a big difference. And I know we also have the contact information for local SHIPs listed on pages 114 to 117 of that Medicare intro reference. So beyond deciding between Original Medicare and Medicare Advantage, are there any other things folks can do to save money?
There are programs out there that can help folks with limited income and resources. One of those is called Extra Help, and it can assist with prescription drug costs. You can check your eligibility on Medicare.gov or get in touch with Social Security. There are income and asset limits. So, yeah, if costs are a big concern, it's worth looking into those programs.
Definitely worth exploring those options. Now, let's switch gears again and talk about avoiding those dreaded late enrollment penalties. We know timing is everything with Medicare. What are the key things people need to keep in mind?
The most important thing is to enroll during your initial enrollment period, that 7-month window around your 65th birthday. If you're already getting Social Security benefits, chances are you'll be automatically enrolled in Part A and Part B. Even if you're automatically enrolled, it's really important to double-check everything, make sure those enrollment details are correct, and make any choices you need to about Part D or supplemental coverage.
What if someone's not getting Social Security benefits when they turn 65? When should they enroll?
If you're not getting Social Security benefits yet, you'll need to actively enroll in Medicare during that initial enrollment period. You can do that online through Social Security or by contacting them.
Okay, so remember, active enrollment is key if you're not already getting those benefits. We also talked about those special enrollment periods for situations like losing employer coverage or moving. Do those situations change the timeline at all?
If you have certain life changes, like if you lose your job-based coverage or if you move out of your plan's area, you'll get a special enrollment period to sign up. It usually lasts 8 months, and you can enroll without those late penalties.
So the system does have some flexibility built in for those unexpected life events. Now, what about that actual enrollment process? What can folks expect when they're ready to sign up?
It's not too bad, actually. You can apply online at the Social Security website, over the phone, or in person at your local office.
What kind of information should folks have ready when they apply?
The basics. Your Social Security number, birth date, and information about any employer coverage you might have.
So it's pretty standard, just like those other government forms. What happens after you submit that application?
You'll get confirmation from Social Security, along with your Medicare card, and information about your coverage choices. Then, if you chose Original Medicare, you can explore Part D and those Medigap plans, and if you went with Medicare Advantage, you'll pick a plan from one of those private insurance companies.
Okay, so you apply, you get your card, and then it's time to personalize your coverage based on what you need. Makes sense.
It's all about gathering the information you need and making those informed decisions.
We've talked a lot about choosing the right coverage, but how do you stay updated about any changes to Medicare? Seems like it's always evolving.
Well, Medicare.gov is your best friend for that. They'll have all the latest info on premiums, costs, and any changes to the program.
Great advice. Stay informed. Anything else people should keep in mind when they're choosing and managing their coverage?
Don't be afraid to ask questions. There are tons of resources and people to help you navigate all of this.
What's coming up in Part 3?
We're going to tackle some common Medicare myths and answer some of those frequently asked questions. Plus, we'll share some insider tips on how to really make the most of your Medicare benefits.
Medicare doesn't have to be a mystery. Remember, you're not alone in this. Millions of people are navigating these decisions too. If you need a little extra help, don't forget about the FAQ sheet and worksheet linked in the show notes. They're great tools to help you make sense of it all.
For our final part of our Medicare exploration, we've covered a lot of ground, all those basics of Medicare, from figuring out the different parts to choosing the right plan and how to navigate that whole enrollment process. Now it's time to sort of tackle some of those questions that come up a lot, and bust some of those common Medicare myths.
Exactly. Let's set the record straight, make sure everyone's got the right information to make those good choices for their health care.
One question I hear all the time is, do I really need Medicare if I have retiree health coverage? I bet a lot of people transitioning from those employer-sponsored plans are wondering that same thing.
It's a good question, and, the answer really depends. It depends on the specifics of that retiree plan in your own situation. Sometimes, maybe that retiree coverage is enough, but other times, it might be a good idea to sign up for Medicare too. The best thing to do is compare those costs and benefits, think about your health needs, and also consider, access to providers.
So there's no one-size-fits-all answer. You really have to dig into your own situation, maybe talk to a benefits coordinator or someone like that to figure out the best route.
Right. Now let's tackle another myth I hear all the time. Medicare covers everything. What do you think?
I'm thinking that's not entirely true. Medicare is great, don't get me wrong, but it can't possibly cover every single healthcare need, right?
Medicare covers a lot, a wide range of services, but there are some things it doesn't, like routine dental care, most vision and hearing services, long-term care. Original Medicare doesn't typically cover those.
So it's good to be aware of those limitations and maybe look into, supplemental coverage if you need it. We talked about Medigap earlier. That can help fill some of those gaps.
Exactly. Okay, how about this one? Medicare is too expensive. What are your thoughts on that?
Well, healthcare costs are a real worry for a lot of people, but honestly, for what it provides, I think Medicare is designed to be pretty affordable. And remember, you've been paying into the system all those years while you were working. Now, Medicare is there to help you get the care you need without going broke.
That's a good point. And plus, remember, there are those programs to help with costs if you qualify. We talked about Extra Help, which can help with those prescription drug costs.
So while cost is a real concern, there are ways to make Medicare more manageable. Now, this whole world of Medicare can feel pretty overwhelming. What would you tell someone who's feeling kind of lost and confused about it all?
The biggest thing is, don't panic. And you don't have to do it all alone. There are so many resources out there to help you understand it all. Go to Medicare.gov, talk to friends or family who've been through it already.
So as we wrap up our Medicare deep dive, what are the most important things you want our listeners to walk away with?
Here's my top 3. Number 1, understand those different parts of Medicare and what they cover. Number 2, make sure you enroll on time to avoid those penalties and make sure you have coverage when you need it. And number 3, don't be afraid to ask for help. There are resources there for you every step of the way.
Medicare can seem complicated, but if you have the right information and a little support, you can figure it out and make the choices that are best for you.
Medicare is a valuable resource. It can really help you live a healthier and more fulfilling life.
Thanks for joining us. Don't forget, we've got all those links to the resources we talked about down in the show notes. And as always, we're here to answer any questions you have as you navigate this Medicare journey. Till next time, stay curious, stay informed, and take good care.
Thanks for joining us on AI DocuFeed. We hope this episode helped make Medicare a little clearer for you. Don't forget to check out the show notes for the frequently asked questions and worksheet to keep learning and organizing your next steps. If you found this episode helpful, please subscribe, leave a review, and share it with someone who could use a little Medicare guidance. Join us next time as we continue to simplify complex documents and help you take control of the information that matters most. See you soon.